Friends, and welcome back to my channel, that is Concepts by Rahul Prasad. Today I am going to speak on a very important topic, that is microvascular complications in type 2 diabetes mellitus. Now let us start with the global prevalence of type 2 diabetes. Global prevalence has estimated that there had been 463 million cases of diabetes in the year 2019, and this is going to increase to a level of 578 million cases of diabetes by the year 2025, and by the year 2045 there will be 700 million cases of diabetes. Diabetes mellitus is a rapidly expanding global public health concern which is reaching its epidemic proportions in the people of lower and middle income groups in the developing countries. The chronic hyperglycemia sustained over several years leads to the development and progression of microvascular complications in type 2 diabetes. Moreover, the elevated levels of blood glucose is connected or linked to the changes in microvasculature, the increase in the capillary basement membrane thickness and the formation of extracellular matrix. Moreover, the underlying pathophysiology of microvascular complication remains the formation of advanced glycated end products, oxidative stress, neovascularization, the polyol pathway and the diacylglycerol protein kinase C pathway. Development and progression of various microvascular complications of type 2 diabetes like the diabetic retinopathy, neuropathy as well as nephropathy has been strongly linked with hyperglycemia, and it has been confirmed by various clinical studies like UKPDS and DCCT, that is United Kingdom Prospective Diabetic Study, as well as the Diabetes Control and Complications Trial, which has confirmed that there should be a tight glycemic control along with the dietary changes and the lifestyle modifications for the preventions and progressions of diabetic microvascular complications. Let us understand the three major microvascular complications of type 2 diabetes along with their underlying pathophysiology. We will start with the diabetic retinopathy. Diabetic retinopathy remains a major cause for the blindness as well as the visual loss. Moreover, the UKPDS study has confirmed that already 40% of the patients have diabetic retinopathy at the time of diagnosis, and the blood glucose, blood pressure as well as the duration of diabetes remains the important risk factors for the development of diabetic retinopathy. Underlying pathogenic causes for the development of diabetic retinopathy is attributable to four important parameters. The first remains the hyperglycemia induced microvasculature damage. The second remains the increase in the capillary basement membrane thickness. The third is the increased capillary permeability, and the fourth is the development of microaneurysms, that is the saccular outpouchings of the capillaries. Now the intravascular coagulation leads to the retinal ischemia that further leads to neovascularization, that is the formation of new blood vessels. Now these new blood vessels inside the retina are very fragile in nature, they tend to break, and this neovascularization further leads to the retinal bleeds, and the lack of lymphatic drainage further leads to the fluid accumulation, and finally it leads to the macular edema. Next microvascular complication is the diabetic nephropathy, wherein the thickening of the capillary basement membrane along with atrophy and interstitial fibrosis further leads to glomerular hyperfiltration that further leads to albuminuria and proteinuria in the later stages, thereby reducing the renal function. The third microvascular complication remains the diabetic neuropathy, that is a major cause of foot ulcerations and the limb amputations, wherein the polyol pathway, the diacylglycerol protein kinase C pathway, the age formation, oxidative stress remains the major underlying causes. Out of several underlying pathogenic causes for the development of microvascular complications in type 2 diabetes, the polyol pathway plays a very important role. Now let us understand what exactly is the polyol pathway. The increased activity of this biochemical pathway leads to increased accumulation of the osmotically active sorbitol and fructose by the action of the enzyme aldose dehydrogenase. There is a depletion of myoinositol and the impairment in sodium potassium ATPase activities, which is implicated in the pathogenesis of diabetic neuropathy. Next important underlying pathogenic cause for the development of microvascular complications in type 2 diabetes remains the increased PKC activity, which means protein kinase C activity. The increased accumulation of the diacylglycerol because of the increased intracellular concentrations of glucose leads to the increased activity of protein kinase C in the endothelial cells. there is an alteration in the vascular permeability and the capillary basement membrane also gets thickened. Third important underlying pathogenic cause for the development of microvascular complication remains the non-enzymatic glycation, which means there is an attachment of glucose to the amino groups of the protein leading to the tissue damage. There is a physical cross-linking of the biochemically altered proteins which alters the structure and function in the vascular walls. Apart from this, the oxidative stress which is caused by the overproduction of reactive oxygen species which is caused by chronic hyperglycemia also plays a pivotal role in the development of microvascular complications. Besides this, the low-grade inflammation also plays a pivotal role in the development and progression of microvascular complications. As hyperglycemia is strongly linked with the adhesion of monocytes to the arterial endothelial cells, the increased amount of glucose is also responsible for the increased activity of certain matrix-degrading enzymes like metalloproteinases, which further leads to plaque rupture and VSMC proliferation, that is proliferation of vascular smooth muscle cells of the arteries. The increased amount of glucose also increases the PKC activity, that is protein kinase C activity, and increased number of pro-inflammatory markers like nuclear factor kappa beta. With the onset of type 2 diabetes, there is also a tremendous increase in the amount of pro-inflammatory markers like C-reactive proteins, nuclear factor kappa beta, interleukin 6, fibrinogen, C-reactive proteins, etc. So with this, I conclude this video. Hope you like this video. Thanks for watching and listening to me.